Assalamu alaikum warahmatullahi wabarakatuh. Again, this is Dr.Farrukh Ahmed, but this is my second video. And first video was a few months back when coronavirus, the COVID-19 virus, was not very old. And now this child has grown up. And it is causing many things to the world, to the people of the world. Today, actually, why I'm posting this, because I was having in mind for many weeks or more than that what's going on with the psychological makeup, the stress levels, the anxiety levels, depression levels, and the immunity levels. These two are very different, but they are correlated in this environment of COVID. I give you example. Daily when I am going to duty, what happens is that in the beginning of the duty or during, my co-workers, my colleagues, doctors and nurses and paramedics, daily we discuss some news about some co-workers in our center, in our group's branches, in the town, in our countries and in the world. What's going on with the doctors and nurses in the present time of COVID-19? Many are dying, some are positive and waiting to see the outcome, what will happen to them. Many of the doctors and nurses and paramedics' families are affected, and the outcome, positive or negative. In the world, throughout the world, also many doctors have died of corona, nurses, paramedics, their families are affected, and many things related to that. I'm discussing more in this video about doctors' fate, doctors' families' fate corresponding to COVID-19 infection. As we know, this is pandemic. It has to spread, it is spreading, it's progressing, it has to progress. With this, we know that doctors are doing their duty, nurses and paramedics are doing their duty as frontliners. You see, everyone has a field in which they can do their duties honestly or less honestly. In the battlefield, soldiers have to fight for their cause, whether this is a right cause or not. They are the fighters. Here, in this COVID-19 infection, doctors and nurses and paramedics and the junior workers related to medical field, they are the frontliners, they are the fighters, they are fighting for humanity, for the cause of humanity, because patients, the clients of doctors and nurses and paramedics and junior workers, they are human beings, the best of the creatures of the Creator. And we have to do our duty at our best to save humanity. What we are facing daily these days is a phase of this pandemic, because you see, the more the time it will take, the more the nerves of doctors and nurses and paramedics would be affected. And you see, this would be affected mostly in the negative way, not in the positive way. Why? Because we are also humans. All the doctors, nurses, paramedics and junior workers who are related to medical field, we are humans. And we have our psychological makeup, we have our mind and thoughts and feelings and everything. The more the time passes, and we have to go through this daily, seeing the patients, trying to protect them from the negative effects of COVID-19. So for that, we have to be in contact with them, using our PPEs, our protective measures and all precautionary measures. We have to see the patients. We cannot deny that. We cannot say, no, we can't, because we are at risk while we examine the patient, trying to diagnose. And then this is the story of the outdoor workers, outdoor healthcare providers. There are also indoor healthcare providers, indoor doctors and nurses, especially, and paramedics, who are related to the patients who are admitted as diagnosed cases of COVID-19 and who are at risk of life, and some of them are not at risk. So these workers, their lives are at high risk. What about their families and their own psychological makeup at this time? The more this phase of COVID-19 prolonged it would be, the more they would remain under stress, and their stress level would also keep on increasing. You cannot deny the fact that doctors and paramedics and nurses, they are humans. Of course, they are humans. They have this positive and negative thoughts. They also become under stress. Their anxiety level also increases. Their depression level also increases. With the passage of time, when they see their colleagues being diagnosed of COVID-19, going to death's bed and dying, and similarly their families affected, and many with the negative outcomes, and eventuality, of course, we know that death is the eventuality. This is not only for the doctors and nurses and paramedics, this is for all humanity. But at this time, actually, I am discussing the mental state of medical field health providers. How they are affected negatively in this period of time when COVID-19 is getting prolonged. We know that it will still take time to get rid of this infection. Alhamdulillah, now we can say that doctors have more knowledge in this few months of time of COVID-19. They have more knowledge now to deal with the cases of the patients affected with COVID-19, mild cases, moderate cases, and serious cases, ICU cases, ventilator cases, and the cases that are near death. And till the end, doctors don't have to lose the hope of saving the patients. And Alhamdulillah, they save many. So how to pass this period of stress? How to relax the nerves? Let's discuss this. This is very important for the doctors to continue their jobs, their duties of saving humanity, of trying to save the humans, the best creatures of the Creator. Almost all we can say all, most of the humans on this planet, they believe in the Creator in some way or the other. Muslims, non-Muslims, other faiths, most of them, they believe that there is a superpower. We Muslims call Allah, they call it different names, God and Bhagwan and Rabb, and that is the super creator, that is the owner of this universe and who created everything. And now, how to relax our nerves? Okay, my opinion and my suggestions and recommendations. First of all, let's make our faith stronger. First of all, as Muslims, we believe that our destiny, our fate is pre-written. This life has to end with the death. At any time that is fixed, prefixed for us. We are not to live forever. Any one of us, we know that we are not here on this planet to live forever. So Muslims believe, as is there in Quran, their religious holy book, that we have to finish this world, finish this life, and we have a life greater than this, much longer than this. And whatever we perform in this world, accordingly, we will get in the life in the hereafter. So, first of all, we have to make clearer to ourselves that our destiny, our fate is prefixed. We don't have to think that we will not die. Then, okay, what's going on is that the fact is that when we are in this life, we struggle to achieve. Not for the hereafter, not for the life that is much longer and bigger than this, but for this life. So we love this life. Although we should have loved the base of the life that would come in the hereafter. Anyway, we are discussing here not the life in the hereafter, we are discussing the life that is under stress these days due to COVID-19. So how to get rid of that stress? So first step is to recognize our fate, our destiny that is already fixed. We cannot change it. If we have to die on a specific time period, we would definitely. So, because of the environment, because of this COVID-19 stress, our nerves are not relaxed. So why? Because we think, what would happen if we are finished, if we die at this time? We think that this is not the proper time of dying. What would happen? What would be going on with our plans? For example, our family, our children, our remaining career, our property, our business, and things that we are still on the way. What would happen to that? That makes us under stress. So first of all, we have to, after realizing that this life has to end, we don't have to be just depressed or on negative thoughts. No. Keep on doing your job. Keep yourself composed, thinking that our duty in this world is, first of all, to the Creator. He has created us, as He says in the Quran, to assess who would obey Him the best way. Obeying the Creator is, He has fixed the rules. There are two basic rules. One is to worship Him, to worship the Creator. And second is that love His creation. All His creation, and the best of them, the best of the creatures, the human being. Human being is the best creature. In Urdu we call Ashraful Makhluqat, the best creature. And Allah, God, the master creator, He wants us to love His best creature, the human being. So that's why when we are performing our duty as medical care provider, the health care provider, first always remember that this is obeying Allah, obeying God, obeying the Creator, who has fixed your duty to do so. So how blessed you are that He has given you, He has assigned you the duty for caring the best creature. Every profession in this world is the best profession, whether you care for the cars, you make cars or you sell cars, or you are an electric engineer or electrician, or you are a mechanical engineer or mechanic, or you are an aeronautical engineer or a pilot or aeronautical mechanic. And there are examples and examples, and throughout this planet you'll find examples. All professions are good, but you the healthcare provider, you are blessed with this opportunity that you have to take care of the best creature, the human. When Allah created the universe and then He created the humans, He compared in Quran and told us that human is His best creature, His best creation. So, okay, first of all, while you're performing your duty, always think that you are providing services to humans. What a blessing. What a blessed destiny you have. Okay, then of course you are doing your duty assigned by your establishment, wherever you are working, whether you are a government servant, whether you are a private employee, you are serving in a private employer or establishment, or you have your own services that personally you are providing services. Always be honest. Provide the services to the best. Whatever you are committed. And then of course this is also in a way obeying your creator, obeying Allah as Muslims, and of course obeying God, because this is also duty assigned to us, that whatever duty you are doing should be honest. So this, if you consider this, I know most of us are honestly doing our duties. I already know that, and we are, of course. But just make the commitment renewed, and then that will make the level of satisfaction even better than before. All right, okay. So, considering the environment, when you daily see, okay, that doctor, that nurse, that has died of COVID-19, the family of that doctor, the son of that doctor, a young daughter of a doctor, or a wife, or mother, or father of that doctor, of that nurse, and like that. There are many examples. We are seeing daily, we are listening daily, and this is a natural cause of stress, anxiety, and depression. Remember that reduces our immunity level, because our body is directly under our mind's control. So, as I'm always advising my patients, and when I see the stress of my colleagues, wherever possible, I try to discuss with them also that we have to relax. Okay, first of all, try to have your mandatory prayers daily. That will relax you. Read your religious book, Muslims, Quran, and then of course for others there is Bible, the Old Testament, the New Testament, Gita for others, and there are others, so that you relax. Okay, then comes that some people, they are relaxed with poetry, music, dancing. So whatever the provision you have for your mind to relax, avail that. You have to avail that so that you relax. And then, of course, try to keep your health up to maximum. Try to have a regular walk or some exercises. Try to have natural antioxidants like almonds and walnuts and cashews and pistachio and olives and garlic and ginger, but all you have to keep at a level that don't hurt your digestive system, your upper respiratory system also, because some food is irritant to some persons in their throats. Some people, they have a digestive system that is overloaded with these antioxidants. So try to keep the limits, the quantity that suits your system. And then you have to keep your digestive system also up to mark. For example, the people who have IBS or irritable bowel, they have to keep their digestive system up to a very good level, so that doesn't reduce your immunity. Because people who have certain diseases like diabetes, like hypertension, like ischemic heart disease, who are stable with their medicines, they should keep their medicines and keep on checking their status. I am discussing this with the healthcare providers to keep their health at optimum level. And if once you are COVID-19 positive, don't lose heart, don't lose hope. Be assured, most of us would be COVID-19 positive with the passage of time, as the pandemic has to progress. It is progressing and it has to. So most of us would be positive, and let's pray that we pass through this pandemic in a way that is the easiest for us and that causes us least harm health-wise, our anxiety, depression level-wise. So, and the most important thing is that if you need some support to control your anxiety or depression, okay, don't avoid that. If you need medical support, okay, as a doctor, as a nurse, as a paramedic also, you may need that, of course. This is life. So don't get shied off. Don't avoid that. Take support from your relevant colleagues, and so that's the best way to keep yourself happier, healthier, more relaxed. So God bless us all with the best of health, best of achievements in the life, best state of mind, and the best faith. And always remember, don't forget to pray to God, pray to Allah. Prayers are the ways that can change the fate, that can change the destiny. Prayers from your heart. Prayers from your heart. So always remember, pandemics are for this planet. We have to get the clues from the Creator. Maybe we have been doing as a whole, the human nation had been doing negative things, many negative things that were not supposed to be done, that were not of the best values that we were supposed to do to others. So always remember to pray, La ilaha illa anta subhanaka inni kuntu minas zalimin. Ask for forgiveness from the Creator. Take His protection. Ask for His protection. Hasbunallahu wa ni'mal wakeel. Hasbi Allahu. La ilaha illa. Alayhi tawakkaltu. Wa huwa rabbul arshil azim. Ya Hayyu Ya Qayyum برحمتك أستغيث اللهم رب إنك عفو تحب العفو فاعف عنا يا غفور يا غفور يا غفور. So just be relaxed and try to keep yourself relaxed. That's very, very important for us all, our families, our patients, our departments, our establishments. So may all of us be with ourselves and the Creator be with us. Take care. Keep yourself safe. Don't forget the precautions. While you are examining patients, while you are diagnosing patients, while you are providing services to patients, never lose heart. All preventive measures have to be kept in mind and practiced. So stay safe, stay protected, stay healthier.